Excellent. I think it sounds like we're ready to get started. So good evening, everyone, and welcome. My name is Michelle DePass. I'm the chair of the Portland Public Schools Board of Education. And on behalf of the board, I'd like to welcome our viewers and our guest panelists to tonight's work session. Tonight, we are joined here by local and national health experts to share with us the current state of play of COVID and to answer questions we have about health and safety measures that we may consider as we rapidly approach September 1st and the start of the full day, 5-day in-person learning. Consistent with the practice of following public health guidance throughout the COVID-19 pandemic, and in consultation with public health experts, we continue to plan for a layered health and safety measure that will help us maximize our shared commitment to full in-person learning in PPS. And that's why I'm really glad that we've trusted partners who can help provide us with the information we need to ensure our decisions are guided by science and take into account the multiple perspectives of our community, particularly communities of color, in alignment with our values of racial equity and social justice. And I'd like to now introduce Superintendent Guadalupe Guerrero.
Thank you, Chair DePass, and good evening, directors, and welcome to our guests and everyone watching the live stream. I just want to offer an introduction and make a few points before turning it over to staff and our esteemed guests this evening. Well, as we're well aware, we've been challenged as a school system, as a community, as a country, and around the world by the effects of COVID-19. As educational leaders, our challenge has been to stay true to our core mission of educating students, even as we confront the pandemic. So we've had to continually pivot and adjust our responses to the reality of COVID infection rates in our community and the constantly evolving guidance in response to the crisis, all while attempting to maintain a continuity of learning, while keeping the health and safety of our students and employees and the broader community in mind. So as educators by profession, from the very beginning, we've said we would be guided by public health experts, not politics, not the loudest expressed perspectives, not popular opinion. Tonight's yet another example where directors in the community will get a chance to hear directly from public health experts that we've maintained communication with all along, who are going to continue to provide guidance to us as we prepare for the reopening of schools on September 1st. So like other school districts, we had to pivot to new forms of delivering instruction during the course of this past school year. We're appreciative of our educators for their flexibility in adopting new technology tools, becoming part of their daily practice. I'm appreciative of our students, of course, for having to do the same thing and make those adjustments and really have their experience, their school experience interrupted. I'm also thankful for district staff for finding creative solutions to ensure our students had access to meals and other necessary resources, like the required technology to access their learning. All of this was an attempt to maintain a semblance of and a continuity of learning, because I think we can all agree there really is no substitute for in-person learning. So this is why we're looking so forward to the full reopening of our schools and our students receiving in-person instruction 5 days a week. This past year, we learned a lot about and put in place a number of health and safety measures that supported our ability to bring students on campus, at least for a portion of their week this past spring and now this summer. It is these layered mitigation strategies, as suggested by public health experts, that we believe will continue to help us ensure the safest possible learning environments for our students and employees. And of course, the conditions on the ground are local and specific. So we're continuing to rely on guidance from Multnomah County Health and our PPS Health Advisory Panel, two entities that are represented by our distinguished guests this evening. So I know the board is aligned with our approach of continuing to follow public health guidance and expertise. Your support throughout this pandemic, even and including in the most challenging of times, has been a steady force and helped us support our plans for safely serving our students as we've moved through each phase of this pandemic in our school system. Thank you for that. And now we're preparing for a safe return to full-time on-campus learning starting on September 1st. And the health and safety measures will continue to be informed by public health experts and incorporate the guidance, recommendations, and requirements in some cases under which school systems are expected to operate. This will include the strong set of layered health and safety measures we can incorporate to keep our students and school communities safe and minimize disruptions to student learning. Just this past week at the board's regular meeting, staff reviewed all of those specific layered health and safety measures that PPS intends to continue as our standard operating protocols. We shared last week a summary and a timeline of how the various public health agencies, CDC, American Pediatrics, Oregon Department of Ed, Oregon Health Authority, along with state leadership, have continued to shift and update their guidance, recommendations, and requirements to school districts. Which brings us now to this evening. Staff will consider the additional information and questions discussed this evening, and then, starting tomorrow, PPS families and employees can expect to hear and start to receive specific communications outlining our district's plans and measures being taken to prepare our students to safely open, our schools to safely open and welcome our students back to school for the fall semester. So with that, I will now hand it off to Danny Ledesma, who will introduce and facilitate this next portion of the evening. Thank you.
Thank you, Superintendent. Good evening, Chair DePass and fellow board members. I'm delighted to support this evening's work session focused on hearing from national and local health experts to help guide our district's planning for the upcoming year. The health and safety protocols that we've been implementing continue to be refined and improved as this pandemic has proven to be quite dynamic and ever-changing, which has required us to continue to align our planning with scientific expertise and national, state, and local health guidelines. So to start out tonight, our senior leaders will help contextualize the implications of tonight's panel discussion by providing a very brief update about our current planning for the school year. So I'm so honored to introduce my colleagues, Deputy Superintendent of Instruction, Sean Bird, and our Chief Operating Officer, Dan Young.
All right, thank you, Danny. Good evening, everyone. Sean Bird, Deputy Superintendent of Instruction. And I just want to go over a couple of highlights and remind you that we have been implementing safety protocols in our schools since March when we reopened for hybrid instruction. We've also been welcoming students to our buildings all summer long. We have a pretty robust summer programming going on right now. And we have those safety measures in place. So students are wearing masks during instruction, and we've had students in our buildings, and we'll continue to practice those safety measures as we welcome students back full time for 5 days of instruction in the fall. As we'll continue to require masks of all students and staff members in our buildings. We do have an online program option, which we discussed at the last board meeting. I just want to give you a quick update today. We have 286 people who've applied for that. So we have 500 spaces available and 286 students so far have applied. And we continue to work with our operations team, and Dan Young's going to speak in a few minutes about some of the more details about our operations work, but we continue to work with his office to make sure our schools are ready to welcome children and there's appropriate distancing. We're following the guidelines from the Oregon Department of Education and the Oregon Health Authority. And so I'll turn it over to Dan to talk about some specific things that we are doing to ensure our safety protocols are being met as we welcome back our principals in the next week. They'll be getting some additional training, and that's what Dan will talk about.
John, can I ask a question? At the last meeting, the deadline was stated as July 31st for the online academy. I'm assuming since there's still open spaces that deadline has moved.
Correct. It's open still. That was the priority deadline, July 30th, but it's still open as we have room still. And today there was a process. The lottery process began and families will get their information tomorrow. More information tomorrow. Those who have applied already.
So if you applied, you're in because you were in before the deadline?
So, well, it depends on the grade level. So there's a lottery process. K1, kindergarten and first grade, and 6 through 12, everybody that applied will be accepted so far because there's plenty of room in those grade levels. Grades 2 through 5, there is a lottery processes happening. And that took place today, and those families will be notified tomorrow. If you didn't get in today, you're on the wait list, and we'll be back. We'll communicate with families start tomorrow about that process.
Great. Thank you.
Okay, good evening, Chair DePass and directors. As noted, we're excited to welcome back students to full-day in-person instruction in less than a month. Our teams are super busy preparing schools for staff and students' return, including restocking supplies of masks and cleaning supplies at each school, spacing furniture to maximize physical distancing, confirming the HEPA filters that are in every classroom are in place and are functioning properly, cleaning air intakes and changing out air filters, and much more. Additionally, our summer cleaning and maintenance projects are in full swing. We'll be wrapping up dozens of construction projects in the next couple of weeks. And of course, we're excited to open the new Kellogg Middle School and reopen McDaniel High School this year. Much of our work at the moment is focused on finalizing the health and safety protocols based upon the most recent public health guidance, including the new Ready Schools Safe Learners document issued just yesterday. In very short order, we will finalize all protocols for the first day of school and communicate to students, staff, and the community. Certainly there's a lot of work ahead, but we're very confident that our strategy of layering multi-safety measures at every school will create a safe and productive learning environment. And with that, I will turn it back over to Danny Ledesma.
Thank you so much, Sean and Dan. So now I'm very excited to introduce our panel of speakers. We have tonight Dr. Joelle Simpson and Dr. Tress Goodwin. Doctors Simpson and Goodwin serve on the PPS Health Advisory Panel, whose purpose is to consult and provide expert, up-to-date information to PPS leaders on the safety and health of our students, staff, and community-related issues to the pandemic. We've had the honor and delight to work with them for a year now. Dr. Simpson and Goodwin are pediatric emergency medicine physicians at Children's National Hospital in Washington, D.C., where Dr. Simpson serves as the medical director for emergency preparedness. Welcome, Dr. Simpson and Goodwin. You will also recognize our local health experts. First, we have Dr. Ann Leffler, who is also presented with Dr. Simpson and Goodwin. Dr. Ann Leffler is a pediatric infectious disease specialist and the Multnomah County Deputy Health Officer and a Tri-County Deputy Health Officer. She serves as the medical director for communicable disease services, including programs related to prevent, track, and treat tuberculosis and sexually transmitted infections. We also have with us Lisa Ferguson. Lisa serves as the Communicable Disease Manager for Multnomah County. Her team's efforts include reducing the spread of COVID and other diseases by supporting individuals who have been exposed and through case management and vaccine access support. We will also be joined later by Jessica Guernsey, who is the Public Health Director and the local Public Health Administrator for Multnomah County. She has worked at the Multnomah County Health Department for nearly 2 decades in a wide variety of roles, including coordinating with culturally specific community-based organizations and state and local partners on a strategic plan for how the region would respond to a pandemic here in Oregon. So as you can tell by the bios of our speakers, we are very fortunate to have so many local and national experts who are here to help be thought partners with us. So tonight, before board members get a chance to enter into some question and answer, we're going to begin with a high-level discussion that's going to be prompted by questions of mine of what our experts are seeing as cases of COVID-19 trend up, and in particular, what we know about how effective strategies like vaccination and mask wearing are for the prevention of further spread of the virus. Following that, we'll have an opportunity to ask them questions as a board that we may have or that we have heard from some community members. So if you don't mind, we'll just go ahead and I'll moderate a panel discussion, and then I'll open it up for the board to ask questions. So for the first one, I'd like to start with Dr. Goodwin. Dr. Goodwin, we continue to share information with our school communities using the Swiss cheese or the layered approach to prevent COVID-19 and maximize opportunities for in-person education and supports. So one safety measure continues to be wearing masks. Can you start us out by reminding us why mask wearing is important and an effective safety measure, and maybe also share with us how other communities are utilizing this safety measure going into the fall?
Sure. Thank you for having me. So the Superintendent Guerrero talked about the multi-layer approach that PPS is taking. And one way to think about it is this Swiss cheese model. So think of a stack of slices of Swiss cheese where each slice is a different intervention. And these interventions include physical distancing, hand hygiene, staying home when sick, and of course, the really important big cheese slices of masks and vaccines. So no single intervention is perfect. Each layer or slice of cheese, and that's why we use Swiss cheese, has holes. But with multiple layers all lined up, we improve protection. So we know from schools that opened up last year that the districts that had multiple layers kept infections very low, in fact, much lower than their surrounding community. And masks represent a very important slice of that stack of cheese. We know that masks work, and in fact, they work a lot better than we anticipated when this pandemic started. We know that COVID primarily infects via the air and breathing in infected air particles that are filled with virus. So the virus enters our nose and mouth when we breathe and infects by attaching to the cells in our airways and passageways. Masks are incredibly effective at preventing the virus from entering and infecting us. And we also know that others can help prevent transmission by wearing masks as well. If someone is infected with COVID, and we now know that even if someone doesn't have symptoms or is asymptomatic, they can still transmit the virus. So a mask on someone that's infected can prevent those viral particles from being transmitted into the air. And we also know that wearing a good fitting mask that provides a good seal is really important.
Thank you so much. I really appreciate how much I learn about science every time that we have one of these panels. So I really appreciate how you broke that down for us. Dr. Simpson, another important safety measure is vaccination. And I want to thank you for joining us earlier in the year for our community panel discussion with communities of color to discuss vaccine hesitation and provide us with really valuable information. I found that several community members and I still refer back to that presentation. So thank you for being there, and for everyone else on the panel who was there as well. But still, here we are. It's August, and across the country, many communities are not fully vaccinated, and many people within communities are still hesitant and reluctant to get vaccinated. Can you remind us why vaccination continues to be important and effective, even against variants? And can you also share what other communities are doing to encourage vaccination? And maybe how are you responding now in August when you encounter someone who is reluctant?
No easy set of questions. Thank you, Danny. And also, I'm very happy to be here. It may be easy to show that, based on sort of the bio that you read, that my passion is truly caring for kids, loving medicine, and certainly I have a passion for really the topic of health equity and mitigating disparities, and particularly, with an emphasis on communities of color. And so I think framing this answer with those, just knowing how passionate I am, I'm going to sort of give it that lens. And what I know as a pediatrician, particularly one that has been working in emergency medicine, and I'm sure my colleague in infectious disease also realizes, that we have evidence for many, many years that vaccines cause adults. Children have survived multiple infections across the years because of vaccines. And we've continued to emphasize in the prior panel where we joined, and I will emphasize again in today's panel, that the vaccine that was developed for COVID, while it was done in an expedited process and with much rigor and with many eyes on it on a microscope, it was certainly done with, I think, the scientific detail that it needed in order to be safe and effective for us. The scientists and us medical professionals, when the vaccine came out, certainly critiqued it heavily. I think setting expectations for communities, particularly those that may not be as versed in healthcare and medicine, understanding that the vaccine is not a one-stop shop. It is part of one of the slices of cheese, as Dr. Goodwin mentioned, is really important to give it context. And I had mentioned before in my prior session that I love analogies, and I think about the vaccine like a seatbelt. When we're about to drive on the highway, and when we know that the speed limit is over 60, we do not only the seatbelt, we make sure our airbags are intact. We make sure that we are not inebriated. We do every possible measure to maintain safety. And every single one of those steps are what help us, even if you get in an accident, to walk out alive. Similarly, the vaccine is able to help prevent death, help mitigate your risk of being hospitalized and significant illness, whether you get it or whether you're able to spread it to others that maybe will be more vulnerable because of underlying immune compromise, et cetera. So it pains me when I do still, despite the different ways that we try to appeal to those, whether to educate about the statistics of vaccines historically, the science and rigor of how we have developed the COVID vaccine, or even just sort of the logistics and analogies of what we've done in healthcare and science to protect communities, that we still have people that are resistant to obtaining the vaccine. And I understand that because even myself, coming from a family that are not full of scientists, I appreciate that they continue to ask questions. And I think that's one of the things I would encourage, not just the people on this call, but those in the audience to keep asking questions and challenging the science. And I love that PPS has welcomed us and we continue to provide data as best as possible as it evolves. So what I do present to those that are hesitant is really that sequence of facts, whether it be analogies, whether it be science and data. And as time goes on, we continue to have more and more evidence accumulated, not just in the labs, not just in the pharmaceutical companies that develop the vaccines, but also in real life across the world in playing out to see what the impact of the difference between those that are vaccinated and those that are not. And it is continuing time and time again to show that if you have that vaccine, you are wearing your seatbelt. It can save your life.
Thank you so much. Well, let's bring it to a little bit of a more local context. And so I'd like to start by asking Lisa Ferguson. Knowing what we just heard from Dr. Simpson and Dr. Goodwin about the importance of wearing masks and vaccination as part of a multi-layered strategy, I'm wondering if you could share with us what have you seen from your role as the most successful or maybe promising strategies to increase mask wearing and vaccination here in Portland, in Multnomah County, if you will.
Sure. Yeah, I can try to speak to this. I think that right now we're having a lot of conversations about mandates versus voluntary. And I think, we have been very fortunate in Multnomah County that in general, people have really followed recommendations and have shown that, when we've asked people to wear masks, for the most part, they have done so. And we've been fortunate in that we've kept our case numbers, low compared to other parts of the country for the most part with COVID-19. So in general, we've seen that people here tend to, follow the recommendations that public health is putting out. I think that it's really important for us to, as a public health agency, to make sure that we're using data when we're presenting things like why we're asking people to be wearing masks and why we're asking people to be vaccinated. And so we really do use data to drive those decisions and to be able to say, we can see that, we fortunately have a lot of data to tell us about transmission in classrooms, and that when kids are wearing masks and that when they are following that distancing, that we don't see a lot of spread or transmission in classrooms. And there's a lot of good data to support that. And so we know that if we can keep those safety measures in place, then we're less likely to have spread within classrooms. And so I think that, we've really, because of the relationship that our health department and our schools have, we've really been able to communicate all along. And I think even before the governor put out a mask mandate, it was a conversation that we were having and really talking about what we were recommending as a public health agency. And we've consistently heard from Multnomah Education Services District and Portland Public Schools that they value, the input of public health experts. So we've been really appreciative of that relationship. And I think that has helped us as well to get buy-in, for people to understand the importance of wearing masks.
Thank you so much. And I think I was remiss and didn't let folks know that you're also a registered nurse. So
I am.
The full
and I will add that I also have children in Portland Public Schools as well. So
even better. Thank you so much. All right, Dr. Leffler, we'd love to kind of get a little bit of a perspective of yours around kind of taking some of the information that we just heard. And so as we look to begin the new school year, we want to at PPS, and of course everyone here, we want to really ensure that we continue to be thoughtful in our planning as we really take seriously our responsibility to students, families, staff, and partners. So can you describe for us how our local community is responding to changes in the pandemic, and how really there's an opportunity for aligning as guidance continues to emerge, and maybe tell us a little bit about some of those changes. And I believe you have some information for us as well.
Right. So I prepared these few slides. Unfortunately my computer crashed, so I'm both right now. So I'm hoping my audio still works for you. I just prepared these slides about kind of the status of the epidemic here in our local community. So next slide, please. This is as of yesterday. On the top are the numbers since the beginning of July in Multnomah County, and the lower graph is that in Oregon as a whole. And now these numbers on the y-axis are different. The scales are different, so you can't compare them exactly, but it looks like it's true that Oregon as a whole is having a faster rate of rise of number of cases, and that is in fact true. So they've had about a 6-fold increase since the beginning of July in Oregon as a whole, whereas in Multnomah County, we haven't had quite a 4-fold rise over that same time frame. But it's significant and it's a surge, and I'm sure many of you know that the modelers are very concerned about where this is all going. Additionally, besides our case counts going up, we're also seeing an increase in percent positivity of cases, tests, number of positive tests versus the tests being performed. And most recently in Oregon, that was 10.8. In Multnomah County, I think it was between 5 and 6, which is a distinct increase over what it was. Next slide. This slide comes from the American Academy of Pediatrics and shows the number of cases in pediatrics versus adults, and they pull these data weekly. They do an amazing job of tracking this data, and this is nationwide. The light blue bars are the adult cases, and the dark blue bars are the pediatric cases of COVID through these weeks from April. And so we all know that the United States as a whole is going through another surge, and the word on the street is that pediatric cases are increasing and increasing in severity. But I will tell you that the data is really, truly hard to interpret because children have not been tested consistently. You all know that children have had less significant disease, with, of course, the exception of very young children and also the children who suffer the multisystem inflammatory syndrome of children. Those, of course, are the two exceptions to the very severe disease. And so kids are not tested as consistently. It's not comfortable. It's for lots of reasons. Kids haven't been consistently tested. And so we don't know the true numbers. But again, anecdotes are that hospitals are seeing more pediatric admissions with COVID. I heard that one of the biggest children's hospital in New Orleans is full right now. I know that anecdotally at Randall, they're seeing consistently more pediatric admissions. Next slide, please.
Can I ask you, is your definition of child, is that under 12 or is that under 18?
I'm smiling because the AAP goes to a lot of detail to say that they weren't able to have consistency because in all the reporting jurisdictions where they pull their data from, there's not consistency. When we think of adolescents, sort of 15 and over, we really think of those people as, through the course of the pandemic, transmitting the infection and having symptoms of the infection that are much more adult-like. So when I think of, am I worried that cases are going up in pediatrics? I think of, I'm worried that things are changing in the less than 15-year age group. Next slide. And please chime in with more questions. That was a great one. I think I have one more slide to show. And then finally, this is on the left, on the bottom is the Oregon case rates by demographic group. So you'd have to like have your face right up to the screen probably to see these numbers, but you can pull these off the OHA's Tableau site. But the top is 9 years and younger, and these bars, the gray and the red, are case rates. So these are not raw numbers. These are rates by per 100,000 population. So that you can see that in the younger age groups, these children have always had significantly fewer cases. And the orange bit is the hospitalized group. And you can see, the not hospitalized, and gray is hospitalized. So children have always been rarely hospitalized compared to older individuals. And then the dark blue, I think it is. I'm sorry, I'm struggling to see it because the teletyping thing is going over it. I guess the dark blue is the hospitalized. So children are very, very rarely hospitalized. And fortunately, they very rarely die. So on the right-hand side, you can see that in Oregon, as of yesterday's posting, only one child under 9 years of age had died. And then the final bit of this small slide presentation is the Oregon variants by collection date. So we hate those variants. These are really just driving us crazy. The Oregon suffered during our last surge alpha variant, and that's in that pretty blue color. I think the prettiness of the color is very deceptive, makes me angry. But the alpha variant was, we said 60% more contagious than the original SARS-CoV-2 strain. And now Delta is considered to be about 60% more than that. So 2 or 3 times more contagious than the original strain. Are not in an unvaccinated population who had never had the infection. So if the population had no herd immunity, we'd be talking an R naught of 6 to 8. So, getting as bad as chickenpox. So really very, very contagious. So that mustard color, and I don't like mustard. So there you go. That's a good way to think about the mustard color segment is the increase in the proportion of the Delta variant. So you can see that about 6 weeks ago, we had no Delta variant. And then every single week in Oregon, we've had increasing numbers. The estimate is right now that we're running more than 85% of the viruses tested, which is about 5% of all the strains that are tested in the state are the Delta variant. And you can be proud of Oregon. We have actually a very robust sequencing process. So we've been sequencing wastewater, not something nice to think about at the dinner time, but we've been studying wastewater and looking for these variants as an early indicator of risk in our community, as well as having several different health entities who have been contributing to sequencing individual people who have had the infection. So that, I think when Kara or Jonathan asked me to put together a couple slides, I didn't mean it to be all doom and gloom, but we are in a scary place. And what I'm hoping it does emphasize for you is that we just have to do everything we can to continue to protect our students and our staff from infection. These slides don't talk about breakthrough infection. They don't talk about transmissibility of people who have been vaccinated, but we are still very bullish on being able to collaborate with your teams as we have over the last year plus and help what I like to call keep butts in seats. So help you, support you in designing your mitigation factors that will keep everyone safe and that will keep it so that we can quarantine as few students as humanly possible. That's what we're here for. And we know our task is a little bit harder now. There's just no two ways about it. The Delta variant has changed the game. And as your staff, Leticia, who's our big buddy on our team, said, you know, it's a game changer, and that is where we are, but we're not going back. The students need us. They need to be in school. Their mental health is crying out for help, and we're here for you. So now I had to get off my soapbox, but I can't remember what your original question was.
No, it's actually a really great segue into our question for Director Guernsey, because I think you talked a little bit about doom and gloom, yet there is still a lot of sense around Oregon around sort of like whether or not this impacts me personally. So I believe we have Director Guernsey on the phone, and I want to thank you for joining us again. We really appreciate your support as a PPS parent and your enthusiasm for our schools. And earlier, you spoke quite a bit about some of the work you're doing because COVID has had a disproportionate impact on communities of color, and the importance of taking a public health approach to prevent the spread of COVID-19. And so I'm wondering if you could, even, you know, particularly in August, if you could walk us through how you respond as the public health director when you hear individuals push back on, you know, wearing masks or potentially getting vaccinated or any one of our other multi-layered approaches because they haven't been personally impacted, or they belong to a community that hasn't been impacted, or they see those figures that we just heard from Dr. Leffler and don't see themselves in that. I'm wondering, how do you respond when you get that pushback?
Can you all hear me okay?
Yes, perfectly.
Yes, we
Okay.
can. Thank you.
Okay, first of all, I have to admit I'm not a doctor, although I appreciate you addressing me as one. My family gets a big kick out of that when that happens. I have a master's in public health and 20 plus years experience of applied local public health, but I am not actually a physician. So you can just call me Jessica. First of all, it's a pleasure to be here again. I am a Portland public school parent. My son is going to be a senior at Franklin High School, and I can't start talking without just expressing my extreme appreciation for PPS and Franklin. Lorenzo had a rough end of his sophomore year and junior year, but he actually did really well in school, and that was not by chance. We had amazing support from the teams at Franklin and PPS, so I am just indebted to you all because, needless to say, I've been working quite a bit during this time. So thank you so much as a parent. Yeah, I guess, you know, in a nutshell, I'm a fairly blunt person, and of late I have been really speaking to the issue of vaccine and masks. Quite frankly, a vaccine will save your life, and a mask may save someone else's. I think in this country, in sort of general terms, we are not used to these sorts of situations where other parts of the globe have a tendency to perhaps make decisions that are more around the collective versus the individual. So I think this is a particularly challenging situation. I don't think that's uniform across all communities in Oregon or the United States, but I will say I find it to be particularly challenging when I'm trying to message that, you know, we're basically in each other's care right now, and with each peak and valley of this pandemic, there have been asks of folks to work on behalf of the greater good in the community, and depending on what community we're talking about, that message may or may not resonate more. To your question about, you know, racial equity and addressing community-specific needs, you know, the piece around that we've been doing a ton of work around, and really want to give kudos to my colleagues who aren't on this call, who are working day and night in communities across Multnomah County, particularly BIPOC communities. You know, we have an amazing team in our REACH and Chronic Disease Prevention Program and Community Partnerships Unit, where we've always had culturally specific staff that work in partnership with community-based agencies and communities to specifically address, you know, where there might be a need for additional information, and really recognizing that people want to hear information from spokespeople that they trust. And sometimes that takes a little bit longer than, you know, perhaps other folks who were, you know, very quick to get the vaccine. And I don't consider that irrational. Like, I do not consider that a statement of not caring about the community. There are lots of reasons in different communities where there's been transgressions by public health and medicine that have led to well-founded distrust. So we've been engaged in what I would call hyper-local discussions with community leaders, faith leaders across Multnomah County to bring folks together, obviously virtually, mostly until we've rolled into sort of spring and summer where we've been involved in outdoor events where we've been able to speak with folks, but really ensuring that we have spokespeople that are meaningful to the community. I was at an event, I think it was last week at Dawson Park out in Northeast, and a local band that is well known in the community. The singer was speaking just pure public health out there, talking about vaccination, answering people's questions, and really it was a shining example of the work that we're going to need to do right now. I think it's difficult for all of us right now because with the gaps in our vaccination status, while it is coming up, I was just looking at the numbers, it is moving, it's moving slowly. And that is an issue with where we are right now. So with each couple of weeks, we've been pivoting our outreach and vaccine strategy to get more and more focused. And right now, we're gearing up to work with the state. They've hired a political canvassing group that is going to actually do census tract outreach and partner with us on vaccination clinics that is what I would call hyper local. So that is our next move to really try to increase our vaccination uptake. And I think I'll stop there. I'm not sure if I answered everything.
You did. You were great. Thank you so much. And it was a really nice segue to this next question. So we heard our superintendent talk about our intention to take a public health approach. But I wanted to sort of circle back to Drs. Simpson and Drs. Goodwin, because it probably isn't unique to Portland, but we have heard quite a bit of fatigue from various community members who have, like us all, sort of weathered the changing currents of this pandemic. And as we've learned more and taken new approaches and things have changed, there has been some times where folks have start to begin to sort of wane and sort of begin to distrust the science, right? Because if the science is changing or if the things that we're doing are changing, then can we trust it? And of course, we really endeavor to be a nimble district that is responsive and taking proactive steps to keep people safety, but still guided by science. And so I was just wondering how you are responding to the calls to distrust the science, because something was said at the outset of the pandemic, and now as we've learned more, it's changed. So therefore, can science really be trusted? How do you respond when you hear that, and what advice would you give to our district as we continue to want to be nimble to respond?
Well, I'm happy to start. First addressing the fatigue, yes, we're tired. We're all tired. I went back to wearing my N95 this week, and after kind of taking a break and wearing my surgical mask, and I'm tired of wearing it. I thought we were turning the corner. But things change. And I think what's really important to know is that the virus changed. And this is what we anticipated. Viruses do that. They are sneaky and they're smart and they create mutations. That's how they evolve. And so to expect that the virus wouldn't change and we would be able to maintain the same protections and the same things from the very beginning. People in science knew that was not going to be the case. Every infection that this virus, every time it infects someone, has the chance to change. So that kind of concept of, people have to go back, or we've had to kind of reverse, it's just that concept of this is how this infection works. And the amazing thing is that we have so many scientists working on this that they are anticipating these changes. Obviously, they don't have a crystal ball, but they're really providing us with the best information and studying it. It's every scientist and every physician is working on this right now. This is on the forefront. I think We just got to trust the science, and it will get us out of this place eventually.
I was just going to add, when people talk about the evolution of science, not be mistaken with the plague of misinformation. When we talk about our slices of cheese, we talk about the misinformation mouse eating even bigger holes into that cheese. And I think there's been a lot of data that has come out calling itself data that has not been peer reviewed. It is not supported by the scientists, yet still it makes headlines and is continued to be consumed by the public, and people are making decisions off of that. And so I really, really caution the public, and I really applaud PPS because they have really asked of particularly Dr. Goodwin and myself to present the data, to make sure that it is critiqued, and to really dig holes into it if possible, in order to be sure that the guidance that they're receiving is the best possible guidance they can have in order to lead PPS. So trust the science. I know it's challenging. Those of us in the science field are doing our best to put out the accurate and best vetted information. And as Dr. Goodwin said, we know that you're tired. We are also tired, but it is really, really, really important to really, really be vigilant about where your sources of information are and what you use to actually guide your decisions.
Thank you. Okay, so we're gonna transition a little bit. But before we transition, I did want to ask Kara if you wouldn't mind displaying the slide that has the cheese slide, if you will, that talks about our multi-layered approach, because I know that our board is probably going to have some questions, and we just kind of wanted to put this out there so that people can see the visual. But before we do, I wanted to thank our panelists. I think in the spirit of wanting to really get your advice and your guidance and your thought partnership, we want to open it up to our board to ask questions. So what I'll do is I'll just start with our chair and just kind of follow some of the practices that we've seen, and just ask our board members, as I see them on the screen, if they have a question. And in order to make sure that everyone has a chance to ask questions, I'll go through and call on board members to ask your questions. So if you're on the school board, get your question ready, because I might call on you next. But I'll start with our chair. Chair DePass, did you have a question for any of our panelists? And oh, and one more thing, if you don't mind, if you could identify a panelist that you'd like to ask the question to.
Sure, thank you. And I do have a couple of questions. I believe it was Dr. Simpson that mentioned that the virus is smart and it has mutations. I'm wondering, as a district, how we can think like the virus. Can we stay ahead of trends? And in your opinion, are the recommended vaccinations and masking going to be enough of assurance for the public to send their kids back to school? I mean, if that's fully implemented, is that creating a safe environment for children to learn?
Yes, I think to echo what the other public health experts had shared, which is, I love the statement that vaccines protect us and masks protect everyone else. That itself is tried and true. That, I don't think that changes in any way. And that's been sort of the mantra from the beginning. I believe the best approach really is that this is going to be a team battle, no one individual. And really what it does take is really influencing community behavior in order to change these numbers and to get rid of this curve altogether. As the virus and the variants evolve, no matter what, still the vaccine and the measures of hand washing, distancing, and masking. Because the other thing is that we know over this past year, I personally have seen that we've had significantly reduced rates of kids coming into the hospital for all the other viruses that exist. So something worked. We almost, I can safely say, put some hospitals almost out of business because we were not seeing kids coming in from all the other usual winter viruses. Well, now that communities are open, guess what? Our ERs are flooded with patients, not just with COVID, but with everything else. So 1 + 1 = 2. When the measures were in place, not just for COVID, but for every other virus out there, there was a significant reduction in spread among children. That is probably the best study you can have on a population level. And that's what I would trust in moving forward.
Thank you. And I have one more quick question, and that's is there, looking at the data and the trend lines that we saw a few minutes earlier, is there any point at which the data says we need to go back to distance learning? Is there any, whether that be a combination, a number of the community vaccination rate and the hospitalization rate? Is there any number at which we need to say, okay, let's reassess?
To me, since that is a local community decision, I might defer to Dr. Leffler, who probably knows your community better than I do.
Well, thank you. And I would defer to Lisa Ferguson, but first I wanted to chime in. So you motivated me with this idea of thinking like the virus. And what do the viruses do? Why do they mutate? Well, they mutate by accident, but they perpetuate when they're more successful and when they're able to stay alive and when they're able to recruit as many hosts as possible. So if I'm trying to think like a virus in the school community, that would be using a PDSA cycle, plan, do, study, act. Try a strategy, whether it's the idea of how we're gonna keep kids safe at recess and keep from being quarantined, which is what Lisa and I've been working on with your teams lately, to, what mask style works the best or what incentive works the best to keep kids 3 feet apart so that we can safely attest. Plan, do, study, act, adjust, adjust, adjust. So I love that inspiration. And can I pass it off to Lisa to talk about, what we've been doing all this time to track whether there's a risk of transmission in schools?
Yes, please.
Yeah, so I think, I don't think that we're heading into this school year with a set number of if we meet these metrics, then schools will go back to distance learning. I think that, as Anne was talking about, it really is we have good data that there has not been transmission in schools. We are watching closely with the Delta variant. And so I think as we see the virus change, we also have to pay close attention to what's happening in our local community and being able to make those decisions. I think vaccination rates certainly do make a difference. I can also say, locally, we are tracking some data such as our local vaccine rates and effectiveness. And so that's something, we're able to look really closely and see, are we seeing changes in people who are getting breakthrough cases? How much is that changing? So that we know locally if we have to have concerns about maybe the vaccines aren't quite as effective. At this time, we're not seeing that. So we have a lot of confidence in the vaccines, even with the Delta variant being so present. So locally, we do feel like right now, continuing to encourage vaccines is the most important way that we're going to keep kids in school. And then continuing to, layering is really, we came into our discussions with MESD and PPS saying layering is really the critical public health action. That's what you need to do to be able to ensure. And what we are really asking schools not to do is take away all those layers at once. And, we really need to be careful about making sure that we're not just taking all the measures away, and then we do expect to see more spread. So we're watching the data very closely and communicating closely with the schools around what's happening there. But I don't necessarily anticipate that we'll be saying when we reach these numbers that would prompt going back to CDL. I would also ask Jessica, if she wants to comment anything on that as well.
Yeah, thank you, Lisa, and thank you, Anne. And I failed to say, and it's probably obvious, I feel like so blessed to work with folks like Anne and Lisa who have literally been working night and day locally to protect the health of the community. So huge kudos to them. One of our primary goals right now in public health is to get kids back in school and keep them in school. So, unlike the beginning of the pandemic when we were making primary prevention decisions about, really mitigating front end spread, we're at a very different place right now. And we know the consequences of not having kids in school really enjoying both the learning environment, the social interactions, even with, things like masks in place and other strategies, we know that the consequences of that have multiple effects. So right now in our top goals for public health, one of them is keeping kids in school, which means that we need to focus on, as Lisa and Ann were saying, community spread, hence our advisory around masks and our efforts around increasing uptake in vaccination. So you're going to hear more and more as we get closer to the school year, us messaging that key goal. And really, if any of you have seen me on the news lately, I've been saying, you know, our collective action right now is about reducing, obviously, the spread of the disease, hospitalization, and death. But this is really a rallying call for the whole community to make sure kids can get and stay in school. And I really think that that is the rallying cry that people will respond to. It's very, very tangible and focused. So, you know, I believe earlier you asked, what do we do when folks maybe don't see the impact of the virus itself? Well, I don't know anybody who hasn't seen the impact of the change in access to schools and what that's done, you know, across communities. So, you know, that is something that we take really seriously in terms of, like I said, keeping kids in school.
Thank you. Let's go ahead and turn it over to Director Hollins. Did you have any? Maybe we'll limit it to one question and then we'll do round robin. So, do you have any a question?
Oh yeah, I have a few questions. So you guys will have to come around to me awful lot.
Okay.
So, and just because I'm just curious, you know, about a lot of stuff. Not so much of the science piece, or the way I look at it, the governor already mandated the mask piece. So, you know, I don't really think that's a conversation I need to worry about or bring up. I'm just kind of have questions about some of the protocols that we're going to take if things arise. So, so one of my questions is, you know, what plan do we have or protocol do we have if teacher contracts COVID, as far as substitutes or however that works? Are we looking at staggering arrivals and dismissals of our kids to keep them, you know, distancing as well? The ventilation systems, you know, are, I know about the MERV 13 filters, but looking at the maintenance schedule of replacing those filters, just to make sure that is how that going to be dealt with maintaining those filter replacements. How are we supporting mask use? Are we going to be handing out masks at the schools for kids that don't have them? Are they required to bring their own? And are there certain ones that they can wear or not wear? I was just at a hospital for the last 7 days, and certain masks that they wouldn't allow you to wear inside the hospital. And so that's a question. Is there protocols if kids gets COVID? Are we still doing the contract tracing protocols? So those, and I have some more, so I just stop right there until you come back around.
Oh, I like your style. I like that you got a couple in there and this one. I like it. I'm going to ask Dan and maybe Sean to respond to those.
Sure, yeah, those are all great questions. And what I'll probably do is just give a high level answer, and I can certainly follow up with specifics in more detail. I'll say from a high level, we have this layered strategy of multiple health and safety measures at every school. The way that we operationalize them is through our standard operating procedures. So we've got 25 to 30 different standard operating procedures that provides the detail on exactly how we do contact tracing, how we do isolation spaces, what our cleaning protocols are. We have one specific about how masks should fit and when PPE is required. So we have those processes and we have those procedures, and happy to share those and go over those in detail. We do regularly update those based upon current guidance. There's new guidance that came out yesterday, so we're literally today working on updating those and providing new operating procedures and training and communication. So at a high level, that is how we operationalize our different health and safety measures. Does that partially answer your question? I don't want to take up too much time.
I mean, honestly, no. I still don't know what those are. Are those procedures and stuff going, I know you're sharing with us and the board, are those questions going to get shared with the parents and the community as well, so they know what those are, and how would that get shared with the community? You know, like I said, sharing with me is easy because you just spewed out a email to me, and that's fine. But for the community to know what that is, how that works, and those protocols and procedures, I think it'd be important for that to be with them more so than myself.
Yeah, another great question. And yes, we do share those procedures, those measures with the community, as we do internally with staff. And I'll say it depends on what that specific item is. For example, we've got procedures on how schools get and order additional masks and cleaning supplies. So it's very specific. This is how you go and you make sure that you have enough supplies. That's not something we'd normally share with the public, but we could. But others around requirements around masks, our hand hygiene, and respiratory etiquette, those we do share with the community, and we use our website, and we use email, and we use other tools at our disposal to make sure that we communicate broadly what those health and safety measures are.
And I think, Dan, to put a finer point on it too, I think one of the reasons why we wanted to kind of make sure that the board had the opportunity to hear both from our national experts as well as our local experts is that protocols like around quarantining and contact tracing are really determined by Multnomah County, and then we implement those. So there's a flow of information and an alignment that occurs in terms of sort of how we all work together.
And so as a parent, how do I know how that flow of information goes? Because as a parent of a PPS student, I don't know how that goes. And my kid's been there for the last 2 years. I still don't know. I don't remember seeing no emails or anything like that coming to my email or my wife's email, and I know we're on the list. So I don't know what that is.
Yeah. Well, I think we're writing this all down so that, and I know that David Roy is writing this down too. And I think we want to make sure that like there is a streamlined way to like an infographic to talk about how that is. So that's really good feedback.
Danny, before you go further, just maybe a process point, because I'm getting a ton of texts and emails of people like, hey, ask this question. And I guess to Gary's point also, I feel like this is the opportunity to share things out. So maybe we can have some sort of mechanism if all the questions are being taken, or even the ones that we don't get an opportunity to ask, that there's a place that they go publicly that they then get answered, so that it just doesn't come back to the individual board members. But like I say, I don't think we're gonna have time just based on what's coming into my email during this meeting of like, hey, ask this question. So if we have a place that they go, and then also a place where everything appears like in great detail, because I want to know, add some of the same questions that Gary had on quarantine and contact tracing, and like what are those, even if they are
absolutely,
how can we get them?
Absolutely, that's a great suggestion, and we can make sure that we sort of document all of the questions and sort of have an FAQ. We've got lots of folks we're all taking notes of the questions being asked and sort of move forward. So to save time, it seems like the chair had a suggestion or a question.
Just a quick, it was really another vote for doing an FAQ that would be, instead of just having it living on a website, perhaps do a push notification so everyone could see it.
These are great suggestions. And I'm getting texts from our communication staff who are nodding vigorously. All right, so now that we know that there's gonna be documentation, there will be more questions, but I do wanna kind of round robin, make sure that at least every board member gets an opportunity to ask a question. So I wanna, though, and Gary, we'll come back to you. I wanna pivot though to our student representative, Jackson. Do you have a question?
Yeah, I can't remember which which public health professional mentioned this, but mentioning the negative impacts, sorry, my dog, the negative impacts of wearing a mask. I was just wondering how we can mitigate those adverse effects of wearing masks, like social emotional learning, I meant.
Okay, is there why don't we start with our pediatricians? Doctors Goodwin and Dr. Simpson, have you seen nationwide folks who have done a good job of mitigating some of those social emotional impacts of mask wearing?
Sure. And so the question was the social and emotional impacts and not the health, because there have been really excellent studies showing that even though people feel like they're not breathing as well, the oxygen levels never go down. And they've done those studies repeatedly in kids and people with lung issues. So it's really more kind of the emotional. I think, it's time. I've seen how children, especially the young kids, they roll with it. And, they're modeling the people that are seeing it, making it fun, getting fun color masks. I got these fun, bright color masks for my kids, and they like them there too. They don't love them, but they try. And, I think there's some for people who have are lip readers. There are innovative masks that have a clear window so people can use those. And even just anybody that doesn't necessarily have lip reading, just seeing someone's mouth and being able to see that their emotional response or how they're talking can be helpful as well. And then, taking advantage of the times that you can take off the mask when you're outside, go sit outside, enjoy the nice weather, sit, enough apart, and really, maximizing that time, I think is really important. I don't know if Dr. Simpson has anything else to add.
No, well said. I know that we're crunched for time. I don't have anything else to add.
All right, thank you. Let's move to our board member who's on the phone. Amy, did you have a question? No, maybe she's not on the phone. All right. Ailey, Director Lowry, did you have a question?
Yeah, so I have one that might be for Jessica, which is, are there, if there's a positive COVID exposure in a classroom, are there different quarantine protocols for vaccinated and unvaccinated students and staff? Do we know? Yeah.
Jessica, do you want me to take that?
Please, I was just going to say, Lisa, go ahead.
Yeah. So yes, there are. So generally, our Multnomah County Health Department team follows the Oregon Health Authority investigative guidelines for follow-up that we do with COVID-19 cases and contacts. And so our current state investigative guidelines allow for people who are fully vaccinated, which means 14 days past either your second dose of a 2-dose series or your 1 dose, that you do not have to quarantine if you're exposed to COVID-19. Though we do still recommend that people very closely monitor themselves for symptoms and stay at home at the first sign of any symptoms at all. So that will be allowable. And the conversations that we're having right now are, what does that look like? Because COVID-19 is not a required school vaccine. So we are having the conversations too of, what does that look like? Because it is a little bit different than when we have a measles exposure and, we ask for the students' vaccine records. We're able to quickly determine who is susceptible or not in a classroom and recommend quarantine. So we're working through some of those details right now of what that's exactly going to look like. But in general, we do allow for vaccinated people to not have to quarantine.
Thank you.
Mm-hmm. Thank you. All right, Director Scott, welcome back.
Thank you. Yeah.
Hey, Jenny. Oh, sorry, Andrew. I'm happy to go after you, but this is Amy. I was muted before, so you can come back around to me.
Go ahead, Amy. Go ahead.
I was involuntarily muted. Not your fault, Kara. One question I had, which I presume it's not for our health experts, but it's a question I want to get on the books for our staff, and I'm happy to have it answered later by email. But it has to do with our considerations around mandating vaccines for any or all of our employee groups. And if any of our public health experts want to weigh in on sort of what our local landscape is on that, that would be of interest as well. That's the first question.
Are there any public health experts that maybe Jessica, any updates on mandating?
Can you hear me okay?
Yes.
Okay, sorry. Some mute thing happened and I don't know what happened. Can you repeat the question? I only caught part of it. I heard mandates, but I didn't hear the whole question.
Go ahead, Danny.
She wanted to hear sort of where staff were on mandating vaccinations for employees, and then said, are there any health experts that want to chime in on those types of mandates? So I put you
Specifically locally.
Yes.
Yeah, so we are definitely seeing several different mandates across the state. I think universities were the first large group to almost wholesale require, at least in Multnomah County, vaccinations for students and staff. The governor announced today that they're moving forward or directing OHA to implement mandatory vaccinations for healthcare workers. We don't have specifics on that. That's a huge change. So we're looking at that. Lisa and Ann, I don't know if you have any other situational awareness on mandates.
I don't. Sorry.
Yeah, I'll just chime in that obviously it's very political. If you're a private employer, the healthcare thing was tricky because there's a law in the state of Oregon, but for other private entities, you can require vaccines, but you also have to make accommodations. In the case of the healthcare workers, they're saying people have to be tested weekly if they decline. It's not really something in the purview of public health right now, right here. It's more in terms of the private employers.
All right. Director Scott, did you have a question?
So many questions, Danny, but I'll try and limit it to just, one, or maybe I'll sneak in a second. First, I just want to say, Dr. Simpson, I really appreciated your comments about science and how we need to trust the science and not just the data that we see out there potentially online. I think one of the most remarkable set of emails I started getting a few weeks ago were from those people saying, trust the science, ignore the CDC. Which was just a little bit mind-blowing to me, but yeah, it's definitely out there. So I appreciated those comments. I have a question around asymptomatic testing. So my understanding, the district will be doing symptomatic testing for our students. Asymptomatic testing is one of those things as a layperson that's been a little bit perplexing. I know early on in the pandemic, it was sort of viewed as one of those Swiss cheese strategies, doing widespread testing. I read a great article a while back about actually the problems with asymptomatic testing. Because you have to test so many people in order to catch cases, and then there's lots of false positives, and so it has an impact there as well. More recently, though, we're seeing some of that pop back up again, and I can't remember where I read it, but some recommendations around schools and reopening were around doing asymptomatic testing. Is there a consensus around whether that's a good idea or a bad idea, or is that one of those things that continues to change as we learn more? And maybe that's for Lisa. I'm not sure who that's for.
I think from our team, Ann might be the best one to speak on that.
Thanks, Lisa. The trick about asymptomatic screening of individuals who are not known to be exposed is that it leaves the tests with enormous declines in specificity in particular. So the tests are just not very accurate when you use them in that setting. And so you could test a whole bunch of people and exclude people, or launch into a situation where you're, for example, excluding a whole group of kids for an inaccurate answer. So that's a big part of the problem with screening asymptomatic people. The other problem is that it's very expensive for the yield. So I heard Melissa Sutton today from Oregon Health Authority, who, by the way, is your medical advisor for school-based testing, and under whose CLIA waiver all that testing is being done. She said that the estimate is that it costs $10,000 to prevent a single case. Now, of course, if there were, the 1% of people who die, or less than 1%, of course, that would be well worth it. But if it's to prevent a relatively not sick case and it had a bunch of negative downstream effects, it wouldn't be valued. So I'm not a big fan of asymptomatic screening. Yeah, that's the bottom line.
All right, thank you. I feel like we're close to entering a speed round. So Director Brim-Edwards, did you have a question?
Yep, several questions. And actually, before I get to my questions, well, first of all, thanks to the panel. It was a great frame up. And before I get to my questions, I do have a question though on this, and this is maybe more for PPS staff. I'm really supportive of the governor's, given the Delta variant and all that we know about it, the requirement that masks be used inside for students. And so my question is, we've had summer school underway, we've got sports. When we have our students, I'm looking for like PPS real-time data, when we have students in summer school in a mask environment, how many cases have we had and how many cases have we had of vaccinated students? And that's just, I'm just looking for the framework because it seems like the rest is context, but it's actually not specific to our students and our experience. I'm curious, like just before I get to my questions, what our data shows for this summer?
I don't know that we have that off the top of our hand right now. So since we have our experts, why don't we maybe move to the question for experts and we can get back to you.
Okay, well, I think just given that—
Maybe by text.
Yeah, so I think it's an important piece because we're dealing with a lot of information about, hey, in this state, this is happening, or among adults, this is happening. And I just think in order to, I think, build confidence in masking and vaccines, it'd be great to have real-time data, because otherwise we'll be reacting to things that maybe aren't actually an issue in PPS. So some of the questions for the experts is, do you have a point of view on the mandating of vaccines for staffs that are in our schools, and or with the alternative of, which a lot of places are going, and the governor today with healthcare workers asked if you're not going to have proof of vaccination that you're testing. Do you have a point of view on that, or is that an effective strategy, or is that sort of chasing after a small number of individuals who in the larger environment, school environment, who it's not worth using that strategy?
So
sorry.
I was going to say, I feel like maybe we kind of tried to ask them that question a little bit earlier. Did Jessica, did you have an answer for Director?
Well, I think it's a mixed bag. It's a complicated issue, vaccine mandates. I think I have concerns about the capacity to implement widespread testing for folks that decline or opt out of vaccination. It's probably not news to any of you. We are in a massive staffing shortage right now. So there's some real operational challenges, and I suspect there'll be a lot of negotiating with the governor's announcement in the next week. And as you all know, again, vaccine mandates are tricky, and there is usually a mechanism to opt out. So it's a slippery slope. I understand the inclination to do it. I also know that sometimes it doesn't necessarily manifest in what we think it's going to manifest in.
Great. So we are really close to time. I'm so sorry, Director Brim-Edwards. And we don't have a lot of time. So what I wanted to do is just maybe do a speed round and ask our directors, start from the top again. If you have a question for our health experts, you have staff at the ready all the time, but if you have a question for the experts, we're going to do a speed round of questions, one question, and as quickly as possible. And if you can make it, design your question so that our panelists can answer quickly. And if you don't mind directing it to a specific panelist, one question quick, and we'll do one question for each of you. And that should take us right up until time. And I know our chair will get us, we'll do a quick close. So I'm going to start with Chair DePass, and I'm going to take facilitator's privilege and really sort of make sure that we move this along. Okay, so Chair DePass.
Okay, quickly, it could be for any public health expert. What do you recommend, or how do you envision lunchtimes happening with kids, particularly those that are, under the 4th grade?
Let's have Lisa answer that one, if you don't mind.
It's a hot topic of conversation at the state and local level. I can tell you we are actively having those conversations. There's new guidance from the CDC that allows us with masks on and 3 feet or more of space to not quarantine kids. So we're really trying to figure out how to implement that in spaces like lunch. So it's an ongoing conversation, and we will be sharing that information as soon as we have kind of our recommendations around that as well.
Thank you, Gary. Dr. Hollins.
Okay, so I'm gonna try to ask this question so our panelists can answer. So it's a 2-part question. So I've seen on the slideshow that the distance requirements is 3 feet. So and I don't know what expert can answer this. Whoever want to answer is fine. What do you guys recommend for the social distance at 3 feet if 3 feet is not allowable in a classroom that has multiple students or more students that can allow for 3 feet distancing?
Yeah, I'd like to chime in on this one. We've been talking about this a lot. And again, not in isolation with your teams at PPS and MESD. My personal thought about for the younger kids is to cluster their desks together into what I'm calling a pod, and that then the distance to the next pod is more than 6 feet, ideally, or at least a solid 4 feet, so that if there's an exposure, we have a finite number of kids who consider to be contact. And then we're bantering about all sorts of other ideas to present to your teachers. I know that wouldn't really work in high school, but just the idea that smaller groups of kids could be identified if people need to be excluded because they're exposed. Thank you for the question.
Okay. One last question is about our special ed kids. The masking, is there a different masking protocol for our special ed kids versus our non-special ed kids?
Vaccines. It's called vaccines.
All right, Jackson.
Okay, my question is probably either for Lisa or Anne, and it is, what is the largest challenge you think PPS or just Portland in general faces as we head into the new school year?
Well, I'm going to go off script here, and I'm going to tell you that I'm really fearful about the mental health of our students. And to that end, there was a really nice document that was released by ODE today, and our behavioral health team is also working on developing a toolkit to share with kids and families, and then with schools. And we promised this to the superintendents a couple months ago, but we want young people to have coping skills. We want them to have a place to turn. We want them to have a place to say it out loud. I'm a big Olympic fan, so like Simone Biles did. And that's actually what I'm afraid of, is that it's going to be really scary for some kids to go back to school. So I'm excited about what ODE has done to support that care and compassion first week in school.
Great, thank you. Director Constam.
I wonder if there's any conversation locally around, can you hear me? Around indoor athletics. We had a mask mandate for indoor athletics last spring when most other districts in the state and the nation allowed high school students who had been vaccinated to forego that. And it's a question that kids are asking, and I wonder if we're thinking about that.
I think my response would be from a public health perspective that we already are asking kids to be wearing masks inside in schools because we're concerned about risk, and that indoor sports increase that risk just because of the nature of what you're doing. So I don't know that I would necessarily recommend. I know there are some sports that there are masks, not used because of some safety issues or concerns around that. But I think in general, I would still recommend wearing masks indoors for sports.
Chair and Director.
Oh, sorry.
I'm listening really attentively in the way that I know staff is, and I know this evening we really wanted another opportunity to hear from our public health experts, but I've really appreciated the line of questioning. I know I can clearly sense that board members want to get into some of the nitty-gritty operational aspects. I can assure you that there's been a lot of thought that you're going to begin to see in our messages to staff, to yourselves, to the community and families. Tomorrow will be the first volley of that. Clearly, we'll need to have an iterative rolling FAQ to capture the theme of some of these questions. So, and we have to work with different entities, with athletics, with OSAA. They've already said, well, obviously with swimming, you're not going to wear them. And with wrestling, that could be a hazard. So, those might be two places where when you're in active competition, you won't be wearing them. For instance, our cleaning protocols, this is what they are. For our SPED students with particular disabilities, here's where the exception lies. These are all the specifics I know that our families are going to want to know, and we'll start off at a high level tomorrow to our community, and we'll be getting more specific. As always, through every phase of this pandemic, we have a whole dedicated website to keeping information posted there. The good thing is it's early August. We have a number of weeks. We're going to hopefully be able to answer, all the questions and concerns our parents might have, so they can feel confident that we're as prepared as possible to welcome them back to school. So please know we want to hear all your questions, and we want to be able to offer the most thorough response that we can. And in most cases, we have pretty specific protocols, and we want to make sure that you all know that.
Absolutely. All right. So we've got a few more board members we're going to go through really quickly. We're near time. Director Lowry.
My question is for Dr. Simpson. Do you have any quick tips for parents of wee ones about how to encourage mask wearing in all day long? I've heard some parents concerned about how they're going to convince their littles to do that.
I honestly believe a lot of it is what Dr. Goodwin mentioned, which is modeling. And you make it as appealing as possible, whether it's cartoons, masks with characters that they relate to. And honestly, it's modeling. Kids will do what their parents and what the people that they respect and care about them do around them. So that's my best advice.
All right, Director Scott.
Thank you. A quick comment and a question. In turn, Chair DePass asked about how do we know if things get bad enough that we need to move away from in-person learning? I would also ask the other side, which is, and this is more of a comment, it would be great if from a public health perspective, we could have metrics for as things get better, which I mean, they will eventually, maybe it's 2 months, maybe it's 6 months. But when can we have kids stop wearing masks, right? When do the risks drop down low enough? I think that's something that parents are really going to want to know, and obviously not asking you tonight about that, but when would we know? Because this policy won't be in place all year, right? I think we need to adjust as we learn more about the virus. The question that I have for Dr. Leffler, you mentioned that, obviously we need to protect our children, and I could not agree more than that. So I'm even hesitant to ask this question, but I think it's important to ask. But I just want to preface, it's not coming from me. It's a question that we see online all the time, which is that you also presented data that showed that, deaths are extraordinarily rare for children. Hospitalizations are very uncommon. And the question comes, and I get this in my email all the time, so why do we need to protect children? COVID really doesn't affect them very seriously, but all these other actions we're taking are having a big impact. And aren't we sort of out of balance on that? What's the right response to that? Why we need to protect our children from COVID?
Thanks. And unfortunately, I could talk a super long time about that, but I like to think about this as we still do need to protect the children. So if your child is one of those young infants, for example, who died of the actual COVID disease, COVID pneumonia, or your child has long-term myocardial dysfunction or clotting from MIS-C, or has long hauler syndrome, that's not inconsequential. So I think that it does behoove us to protect the child. It behooves us to protect the family. So that child, now that with the Delta, there is more transmission between children. So I'd like to keep that transmission not happening in schools, because I think that the academic and mental health support and success of kids is paramount to their lives. But we can't have them bringing virus home to their families, and we can't have them bringing it home to the community, because they're, even if you in your family they're not vulnerable people or unvaccinated people, there are vulnerable and unvaccinated people in the community. So I think there are still all those reasons, and I really would actually love to have a conversation with Jackson about the masking, because I honestly have thought it was, you know, not that detrimental for kids. So I'd like to hear a different time about what the experience has been like for you, because I've been a hospital-based doctor for 18 years, no longer. That's how long I've been in Oregon. I shouldn't even say how long I've been working in a hospital, and we wear masks a lot, but I want to hear what it's like for kids, because as compared to all the other risks, that has felt low risk to me. So that's how I would answer people.
Great, thank you. Okay, Director Brim-Edwards, one question. Oops, you're on mute.
Yep, thank you. So I really do want to get the data that I asked about PPS, and I would just a comment. I've never had more emails and texts during a board meeting on a topic than I had tonight, and to me that shows that actually parents and community members want to know the operational details. I think as a way, it's not because they're doubting the experts, but I think it gives them data points to better understand something that's, I don't think any of us have lived through before. So I would really encourage, the more information we have more sessions, like so we have an opportunity for our community to get comfortable as we head into the fall. The question I have, and I'll defer to anybody who feels like they want to answer it, is what's the most important, this is still on the data thing, what's the most important data and information that we can provide to parents and well, primarily to parents as they get ready to send their kids back to school full time, especially given the sort of ever evolving nature of the virus?
Did you want to pick an expert to ask?
I don't know, anybody who feels qualified to answer that. You know, if you're a parent and you're also an expert, like what do you think is the thing that parents most need to know in order to feel comfortable? Because I agree, they need to get back to school. That's super important. But look, what is the data, the science that you think is most useful to parents to convince them like it's safe to go back to school, vaccines are safe, masks are good?
Sure.
Preventative.
Let's maybe ask one of our pediatricians.
Sure, I can take a stab at it. I mean, I think when parents want to know what's the most important thing that they themselves can do, it's getting vaccinated. The parent, and throughout this whole pandemic, parents are typically tend to be the most likely source. And so them getting vaccinated is the absolute best thing that they can do if you have a child that's not old enough to be vaccinated. And I think, you know, spreading that word, making sure that their friends and their families are vaccinated. We know that vaccine is the most important layer of our multi-layer strategy. And then all of the other things are also really important. And I think educating kids, keeping them aware of the misinformation and educating your own kids so that they can then spread the correct information to their friends, and who will then hopefully spread that good information and accurate information to their families as well.
Thank you so much to our panelists and to our board. I know that it's really, we could take all night. So first of all, thanks for spending a little extra time. I'm going to turn it back over to our chair, who will close us out tonight.
Yes, thank you, Danny, Ledesma, Dr. Simpson, Dr. Goodwin, Ms. Ferguson, Ms. Guernsey, and Dr. Leffler, and my board colleagues. We're really fortunate to have the support and partnership of our health experts, and we know that this time that you give is in addition to your day job. Very mindful of the fact that we've gone 10 minutes over, and I appreciate your being here. I want to say it sounds like next steps are to compile a list of questions and compile them into an FAQ that parents can have. And I agree with Director Brim-Edwards' comments that parents, I think this is one of those cases where more information coming from the district is going to help us, and more information is going to be better right now, because as people are deciding, you know, what to do, need that trusted source in the community. Our next board meeting is scheduled for 6 p.m. on August 10th, and this work session is adjourned.